So we're really excited about our new Shockwave unit that we have. We have actually two of them. One of them that literally, I think there's only like two other people in Dallas that have it. So we're going to be talking today about how we can end chronic pain and arthritis with this technology. So a little bit about me. Some of you guys know me and some of you guys don't. I grew up in Dallas, was an athlete growing up, was a competitive gymnast and played soccer and then played college soccer and then semi-professional soccer and then got into marathon trainings. I'm pretty much that like ADHD kid that just never could sit still. And I've abused my body in so many different ways. And physical therapy for me was just always, I was always so interested in the body and how it works and always had a lot of questions. So it was natural for me to get into kind of this industry. I have been doing this for, gosh, 24 years, which just seems crazy. I don't feel like I'm old enough to be in this field for this long. I probably have three different degrees in the physical therapy realm. I'm just a constant someone that just loves to continue to learn. I wrote a book a couple of years ago on just kind of how we feel pain, just because in our medical system we kind of do medicine the wrong way. And I think we've kind of stopped kind of using our brain. And our big thing that we always say is where the side of the pain is often not where the source of the problem's coming from. But we love doing events like this to just provide education for people. There are some other resources that you can have. And if you're interested in this, definitely reach out. But we have a whole like written resource on this as well. Some people like to hear things, some people like to read things. So if that's something that you would like, then we can definitely get that to you as well. So why do we use shockwave therapy? The big thing is it speeds up healing. So if you have a recent injury, or even if you have an injury, period, it's going to speed it up. So how we kind of like describe it is like, let's say you sprain your ankle, and when you sprain your ankle, you have all the healing components that go to that ankle to start healing that area. Well, when we use Shockwave, every time we use it, it's like healing it every time, but without damaging the tissues. So you're just constantly getting this, bringing everything in that it needs to heal again and again and again as we do the treatment. It reduces pain, it reduces tendon stiffness, it improves recovery, and we have an 82% success rate on recent injuries, arthritis, and chronic injuries. So we've had the radial shockwave for about a year and a half, maybe almost 2 years. And so we got the focus shockwave about 3 months ago, and we've been just getting the results we've been getting has been pretty amazing. And we'll get you some testimonials here in a second. So some of the common misconceptions of shockwave is we don't have time to, shockwave is once a week for 6 weeks and that's it. And then after that, you have about a 3 month period that it continues that whole healing process. And we'll learn this here in a second on just kind of the differences between radial and focus. It's painful. If it's painful, then we're using it incorrectly because we need to adjust it based on how you feel. Like we have to feel it in some things. Nerves, you don't feel it at all. But with like other body parts, other like either tissue or bone, tendon, those kind of things, you've got to be able to feel it for some of that healing to happen. But if it's too much, you can get really sore. So we just have to adjust it to you. And that just can take, just like anything else with physical therapy, if we do too much for the tissue, you can get really sore the next day. And so we just have to go and back off on what we do. It's very similar. It's only for chronic injuries. And no, I mean, we can use this within the first 30 minutes of an acute injury, to really get people back onto the playing field really quickly. It's only for tendons, it's for muscle, it's for ligament, it's for bone. They even have different types of shockwaves for brain, heart, and nerves. And so it's quite amazing some of the technology that's coming out. It's a last resort. Honestly, it should be a first line of treatment in some cases. And if it's, really for someone that has something that is very acute, definitely like first line of defense. How we kind of use is we do an evaluation and we try to figure out like kind of where everything is coming from, and then we'll know how to use it, because there's a little bit of an art, especially when people have had the chronic pain, or even arthritis. And we'll give you some examples of like how we've had to use it differently for three different patients that have knee arthritis. of some sort. They've been three completely different treatments that we've had to do based on their history and what we have found. It can cause damage. Not in 44 years of the use has it created any damage. Not unless you're using the lithotripter really is the shockwave that removes those kidney stones, which is the originator. That's how they found shockwave being good for like tissues and bones and those kind of things, was because they found that when they were using this for kidney stones, they were also finding that it was improving and helping with like soft tissue as well. And so then they've like made it adjustments to what the different types of shock waves that are out there. So it's basically a plug-in modality that has a good success rate. It stimulates healing, which is why we get the healing to go 50% faster. It stimulates differential and differentiates stem cells. So when you use the focused shockwave, which is the one that not many people have, it actually produces your own body's stem cells in that healing process, which is amazing. Um, it increases microcirculation. It works on bone, muscle, tendon, and ligaments. So when we look at radial shock wave, it uses acoustic pressure waves to stimulate healing in the injured, scarred, degenerative tissue. It's very broad, and basically it kind of makes that tissue new again. So a lot of times, especially as we get older, and I'll give you an example, like my knee's trash. I've had multiple knee surgeries from all the sports that I've played. I do not want to have a knee replacement. I have friends that are 50 years old, just like me, and I know three of them that have had total knee replacements. I'm like, this is absolutely crazy. You're 50. Like, this doesn't last. You're going to need another one down the road. I'd rather find ways of helping myself heal to where I don't have to do some of those things. But with like knees specifically, you'll have tissue that just becomes degenerative. And what that means is it basically just stopped healing. And every time you move or use it, it pulls on it and it's not flexible. So when that happens, it'll pull on the bone. And a lot of times that'll even make your knee, hip, joints, it can make those very, like feel like arthritis, when in reality, your tissue is just part of the problem that's happening. So it'll basically, how the radial is, I kind of almost call it like a jackhammer. So if you can kind of think of like a jackhammer, it disrupts all of the like underneath the cement. It disrupts everything underneath it to kind of break everything up in that area. It's kind of the same thing. It basically underneath the skin, it's breaking up any adhesions, calcifications, scarring, tissue damage to kind of again revive it and bring it back to where it's starting to heal again. And that's kind of what radial shockwave does. So it's broad. We can find areas where there's tissue damage. When we look at focus shockwave, that's really pinpoint. It's very, very pinpointed. So we have to know kind of where we need to do it, because if you don't hit the area, it's like think of a laser pen going through. You can move it just slightly and you'll be off that tissue that's damaged. So these use high energy sound waves to target tissues, and this actually produces the focus shockwave stem cells, collagen synthesis, and does bone healing. And this treats the pathology. And so when we use a combination of radial, focus, and PMF, this is where like a lot of magic happens. And when we look at like the PMF mat that we have as a beamer, and it helps with increasing that microcirculation in the whole entire body, but even specifically with some of the attachments and the specific areas, it'll increase it even more to really again flood the area of all the new blood that's coming through there from all the treatments that we've done with this. So this is a collegiate swimmer. He was coming in for chronic back pain, and we decided like, okay, let's just go in, let's do some shockwave. We did treatment. He did really well, but he just was having issues, and so we did some shockwave treatments, and this is his experience with it.
Mhm.
I know, like, you're doing well, and it would kind of come back, and we'd need little tune-ups, and then it kind of started creeping back in again. That was
Yeah.
slightly different. And that's when we talked and said, hey, we have this shockwave um, treatment that we're doing. And I think this is something that can really help you. And you're in the middle of like potentially getting an injection, so which ended up not happening. So tell us a little bit about the shockwave and how, because I think it was only 4 sessions and it was like gone.
Oh
Tell us
yeah.
a little bit about your experience with that.
Yeah. So obviously, like this injury has been really stubborn, and so I tried a lot of things, and Stephanie tried a lot of things too, and like around March, like there had been like the symptoms that I was feeling like last year kind of came back, and I was getting really worried, and because I've done like basically everything with Stephanie, and I've done exercises and everything, and she proposed that we do Shockwave, and so we tried it, and after the first week, like just the first week alone, I already started to like see differences because usually after like a kick set and swim practice, like I usually can't complete it, and the next day I'm like dead. But like the Shockwave, like just after 1 week, my practices with kick practices, like I was able to last longer, and then afterwards, like I just did a few presses and I was all good again. So Shockwave, I loved it, and yeah, it was only 4 weeks, 4 procedures, and basically like I'm pain free. Like this is the best I've been
I'm
since.
like in a lot, like this is the best you felt.
Yeah, yeah.
Yeah.
This is the best I felt. Hmm.
So when we look at this is what I'm kind of pointing through here is radial shockwave. So we really just use those all around the tissues, trying to find where some of the damage areas are. As we get closer to bone, it's not comfortable. And that's where we go in and we can use the focus shockwave, which is really like kind of what this is. So it hits the target of the areas. And so there's times where we use this on tendon because you'll just get better results with the focus shockwave because it's so close to the bone. But we also use this on bone because the bone healing with this is amazing. It literally just takes away the bone edema that you have. Like what I say, when you have degenerative tissue, degenerative bone, you don't have a good blood supply in those areas. And so what happens is this will even bring blood into that bone and reduces the bone edema almost instantly that you'll feel great when it's happening because it now has a blood supply that's going to that area that didn't have a blood supply. So that's where you'll get some of the pain relief like almost instantly. Everyone's a little bit different, like different body parts are differently is what we're finding, but by the sixth visit, it's been really good. So when we look at the mechanisms of shockwave, so shockwaves are pro-inflammatory initially, and they promote a catabolic process associated with removal of damage of the damage. So like when it brings in all the good blood flow and then it takes out all the damage, which is what happens when you have like normal, regular healing that it's supposed to happen. But when you have areas that just have stopped healing, it basically starts the whole healing process over again. So you'll have a repair process that again will increase tendon fibers and collagen synthesis. It increases the neovascularization, it increases all the blood flow into those areas. And then you'll have that growth and strength building, which increases the tendon strength of it, the collagen synthesis, and the blood flow in there. So it makes it actually really tightens up those tendons. So sometimes you have to be really careful because if we know there's like I had a case where someone had like a bone chip. I'm like, well, maybe we can like zap out the bone chip. And they're like, I wouldn't. I wouldn't do it when I was talking with some of the experts because the tendon around it will tighten up around it and they'll have more problems. I'm like, yeah, I don't think I want to do that. But you'll get it increases the strength of the structures. So this is another client who had thumb pain for years, was told it was arthritis. So we did shockwave therapy on her, and this was her experience. So tell us your experience with Shockwave, like before, like you were coming in and you were a little skeptical. So share us your experience about that.
Yes, I did some Google research before I came here, and I wasn't so convinced if it's going to work, but I got a chance to try it, and I am blown away because when I came here, my thumb was in such a pain that I couldn't even move around, and now I'm moving this thumb around without being in a pain, which is I'm amazed. I'm blown away myself.
Yeah. So how's this going to affect your life?
So much better. As a single mom of two small kids, it's day and night.
Yeah. Awesome. So The cellular effects of shockwave. So we have a lot of big names here. But I'm going to make it really simple. So one of the things that it promotes tissue regeneration. So that's that VEGF, the vascular endothelial growth factor. Basically, all that means is it stimulates the growth of new blood vessels. So we get more blood to those areas. Blood vessels that were no longer there are now going to be in that area. It also does bone morphogenic protein, which enhances bone formation. So it just again makes that bone stronger with all the new blood flow that comes through there. So the anti-inflammatory effect is basically when you look at interleukins, the IL-6, IL-10, that all that does is it decreases inflammation, increases immunity, and tissue generation. So this is all the effects of like what focus shockwave does, not radial, but focus does all these things. So when we look at like related to pain relief, so there's a lot of big words in here, but we'll just kind of go through them and kind of explain them. So when we look at like the unmyelinated nerve fibers, so unmyelinated nerve fibers are found in the brain, spinal cord, and peripheral nervous system. And basically, they're there to transmit sensory information such as pain. So you'll start losing some of that. So you won't have that pain transfer that's happening. When you look at like decrease in the substance P release from substance P is basically a neuropeptide that is a primary function as it signals molecule involvement in pain, perception, inflammation, other processes. Oh. When you look at like the central reset, the process of this is to recalibrate the central nervous system, which is made up of brain, spinal cord, and basically creating a more balanced state. So ultimately, you're basically rebalancing that like central nervous system, and then that pain that goes to the central nervous system essentially just goes away from like doing the shockwave procedures. So what and where can we treat? So most of the evidence that's out there is on tendon and bone healing, especially chronic. Um, Achilles, plantar fasciitis, patellar tendon, trochanteric pain, shoulder and elbow pain. It also does muscle and ligaments, like chronic or acute, so muscle tears, degenerative tissue, ankle sprains, recovery from sport. You lower back pain, SI joint pain, but also thoracic only. We can do radial in the thoracic spine because focus goes too deep. You can actually puncture your lung. We don't want to do that. Cervical. Now, cervical, I do use like for the nerves. We've had several people that had like really weird head pain. They had headaches and things like that too, which we got a lot of that resolved, but they still were left with like this weird like head pain. I was like, I don't even know, like I don't know where it's coming from. And they've tried so many different things. And so when we got the Focus Shockwave, I was like, we're going to try this on you guys. And so two of them, very similar patients. And one of them has two more treatments left, but the other one just finished her treatment. But it's interesting because they had very similar results, but you don't feel anything. So when you put on nerve, because you want nerve healing, you don't feel anything with Shockwave at all. You have it at a very low level to just basically reduce the inflammation around that nerve. And so we did it. First treatment, nothing. Second treatment, nothing. Third treatment, they're like, whoa, I had a few days that I didn't have any pain, which is the first that I've seen. And so I was like, awesome. And so we did the next one and they didn't feel anything. And then the next one, it's like, whoa, I had almost a week. And they they had like no pain for a week for the first time. I'm like, that's amazing. And then their pain kind of came back. And by the last one, they again were almost pain free. And all I did was target like the nerve up close to like the suboccipital area. So you can do it in the neck. We're finding a lot of issues like with people in the SI joint area that's creating back pain that we didn't even realize was causing any kind of problem. And a lot of times their pelvis can be in good alignment. That's not what it is. It's just that you'll have like degenerative issues within that SI joint. So let's say like for me, my right knee has been a mess. I've had multiple knee surgeries. So then I'm always using the left side. And so I'm using the left side subconsciously more than my right side because of all the issues that I've had. You can get more shearing on that side to give you some degenerative changes. Or let's say you're someone that always like rides a horse is another example. So you're always getting on the horse on the left side. One side is very like your foot's in the strap and you have to move your leg all the way over and do this kind of maneuver and you're doing it over and over again. You can get some issues within that joint. So we're finding people that we've even helped and we've brought back in to do SI joint with regenerative therapy, and it's getting some really, really good results. Osteoarthritis, knees, amazing. Hips, amazing. Ankles, amazing. Fingers, amazing. It just works really well in all those areas when we do treatment on people. So this was taken from I took some of my staff and we went and did training with some of the top people that use this all the time. And this was like kind of the areas that he essentially treated. I thought it was interesting of the 100 patients, kind of what he treats and as far as like, the body. When you look at the most SI joints, I thought it was super interesting. I was like, whoo, I bet there's way more than what we're thinking in that body part. Next are hips, and then next are knees. And then they have trap, rhomboid, shoulder, thoracic spine, C-spine, hand, wrist, ankle, foot. But we can see kind of like how the percentage of people that they see and the body parts with SI joints, hip and knee being the most. So treatments, when we look at treatments, we're looking at once a week. There's 6 treatments. Usually the first treatment on some things and it's all the body parts we're finding are a little bit different, but usually the first treatment, they will be like, oh, wow, that was amazing. And they'll be hopeful. Typically what we see with people, and it's a little bit everyone's still a little bit different based on the body parts, but visits 2 through 4, you'll be like, it worked. It didn't work. I'm not sure this is working. I think it's working. But then when we get into visit 5 and 6, we notice much better results. And I did this on my knee. It's a mess. Definitely a lot of like bony changes that are happening there. And that's kind of what happened with me. Like the first visit, I was like, oh my gosh, you'll feel very light. And by the next few, I was like, even I felt some bone bruising. I thought, this is so weird. And then I know one time when I was doing it, I was like, I feel like my knee's gotten worse. I don't know if this is going to work. And then, but when I got to like the 5th and 6th visit, I was like, this is amazing. Like I'll wake up in the morning, not even realizing like, wait, which knee was it? I don't know. I can tell on some things that the differences, but I'm really working on getting all my strength back and all those kind of things, but it's feeling amazing. Even if you're 50% better, we still like after the 6 visits, we still need to wait 3 months because to get the full effect of the stem cell production, the collagen production, the protein synthesis, um, it takes another 3 months after the treatment. So then we'll come back in for like a 3-month checkup just to kind of see where we are. And if you're better than 50%, we're like, knock on, let's go. Let's keep on going. You're going to be good to go. If you feel like after 3 months or even 6 months that you might need some tune-ups, then definitely we do some of those things. But we haven't had people here long enough to know kind of what the trends are going to be for that. But they're just going to be just kind of checkups to see kind of where we are with it. So here's just some research, and I just kind of found some stuff on like bone because I know most of us are really interested in that. But this is on Shockwave with like tibial stress syndrome. So basically, when you stress the bone, it's basically a bone fracture, but you created it yourself. Happens a lot with runners. It sucks because you're out of your sport for a really long time because you created it, and you have to I mean, it could be a 6-month process to get back. But what they found ultimately, when you look at the results, are though that when they did focus shockwave combined with specific exercise program, that allowed them to recover much, much faster. So they had basically excellent results with patients that did the shockwave was 82%. Basically a success rate where people had really good results versus 36% when it was just only the exercise group. So it works again really well with bone. Again, other stress fractures concepts, if we use medium to high focused shockwave gave excellent results on treating stress fractures with a faster return to competition and athletic activity. Ultimately, for the most part, when it's going to increase this by a good, I would say 40% faster than what it would. We have another person who I don't think she's on here, but she had a massive, massive calf strain. I mean, she's a firefighter and she basically played collegiate volleyball. And so she was playing volleyball and she was like in her late 30s and she eccentrically loaded on her calf and she like just went down. She had to crawl off the court because that's how bad it was. So when she got into us, she had like, I mean, bruising everywhere. And we're like, let's just do focus shockwave. Couldn't even think about going up on her toes, like was limping in. By the second treatment that we did on her, she was able to fight a fire, which was her biggest fear. And she literally was taking her gear up and down stairs and had no problems whatsoever. And that was just after two treatments. Now she did more to fully resolve it and get back to playing her sport. But after two treatments, she was walking up and down stairs with all of her gear, not having any problems. And when she came into us, she was limping. There's no way that would have taken 6 weeks for her to get to that point with a massive calf strain. Again, bone fractures, bone stress fractures. When you look at those kind of things, it's just all the runners after doing the treatment basically return to pain-free running after using focused shockwave. They do say so. There's like a bone. It's called the navicular, and it doesn't have a really good blood supply. You do not want to fracture that part of the bone. But if it's something that just is very recent, you can actually do shockwave to like improve it where there's nothing you can do normally for a bone like that because there's just not a good blood supply in those areas, but you can increase the blood supply by using the focused shockwave. But if it's too far gone, it doesn't work very well when we look at some of the research on some of those things. But ultimately, the return to sport was, around 12 weeks. And if you have any kind of stress fractures, there's no way. You're looking at months, months and months and months and months, like probably 6 months to get back. And this is like, what, 3 months to get back when we use the focus shockwave. So why do we use focus shockwave? Again, because it can speed up healing. It can reduce pain. It helps with tendon stiffness, improves recovery. 82% success rate on recent injuries, arthritis, and chronic pain. So how does it compare to PRP and stem cells? When I look at like PRP alone, absolutely 100% so much better than PRP. And honestly, if people want to go down that route, if you do shockwave with PRP, works way, 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 way better than when you just use PRP alone. And the reason why is think of like a dry sponge. If you have a dry sponge, that's the degenerative tissue. That's the tissue that isn't moving very well. It's kind of like just like hard and firm. Think of that as a dry sponge. Now, if we take that and we put liquid in a dry sponge, it's not really going to spread out very well. It's not going to help you as much. But if you go take that dry sponge, you do shockwave, which basically makes it into a wet sponge. You're bringing all that blood flow again in it. Even if there's degenerative tissue, it doesn't matter. It's increasing the vascularization of that area to start healing that area again. It becomes a wet sponge. And now when you go and do the injections, you will get more broader soaking up of that fluid because it's a wet sponge. So essentially it works really well when you use both these in combination. Same thing with stem cell. I mean, when you use the focus shockwave, you're going to get stem cell production. It's the focus shockwave. I mean, using the shockwave system overall is way cheaper than stem cell, way cheaper. And honestly, I think you're going to get some better results and longer lasting results with the focus shockwave versus doing stem cell. When we look at a step-by-step strategy, so we want to do the PMF or Beamer, and And this is going to increase that microcirculation to bring nutrition and oxygen to the newly revascular area, reducing pain and inflammation. So when you look at the research, even on like the Beamer that we have, it increases the microcirculation by 30%. That means better oxygen, better nutrients, better detox to that area. So as long as we're using that in the day that we do the shockwave, it just like it all works magic. Then we can use radio shockwave. You want to really use those around the tissues, depending on kind of what's going on with some people. We don't need to use radial shockwave. Like for instance, when you have someone that has fingers, we just need to use focus shockwave on that. We don't need to use radial around the tissues because we're just really trying to hit the bone. But when you have something like knees, we need to go and use radial because there's a lot of damaged tissue around that knee that needs to be healed. And then we can use the focus shockwave to really treat that underlying pathology of the different spots that we find with the radial, as well as hitting some of those bony changes that are happening. And then physical therapy to retrain some of the muscles to get and get to kind of the cause of that injury. So if you've been in pain for a really long time, there's definitely going to be a strength component that you need to get back to doing. But that's really great and easy because that's so easy to kind of like go home, do these exercises, and then let's get you back in a week or 2 weeks. And then we're going to adjust them to kind of get you back to everything that you want to be able to do. So that's kind of like the treatment strategy. Sometimes we want people like as they're feeling better, depending on which body part, we want them to come in for some physical therapy during the shockwave, and others we just want to wait till the shockwave is over. And some don't even need it. Like for instance, fingers. I mean, you don't really need to do physical therapy on the fingers. We can just do shockwave, and you're going to be good to go. So here again is God, I think used shockwave on her whole entire body. But this is one of the TMJ issues. And it's so interesting how she describes it because she describes it like a wet sponge. And that's exactly like how we describe it. But we didn't even talk to her about that. And that's how she described it for a TMJ issue that she was having. She had a lot of scarring from a bad procedure that the doctors could not get an injection into her teeth, like to be able to do any kind of teeth procedures. So it was bad. Like the needles were breaking. They couldn't break the skin because she had so much scarring. So they sent her to us. We're like, yeah, let's do shockwaves so we can reduce this. And then that worked really well that she wanted to use it on her knee as well. So this is her experience.
I don't know why, but for some reason, both insides of both of my knees began hurting a couple of months ago. I felt a little bit of instability in my knees, and my mother has gone through unsuccessful knee replacement surgery. They cut her MCL. I know I'm very familiar with what the MCL can do. So I just kind of thought something has happened on both knees. What have I done? So we start working on the knees, and as you're working, I'm feeling sensations up into my upper thigh. So yeah. I know there's something going on. And after one treatment, my knees felt better. I was rid of the pain was gone, and I haven't had any more of the instability, which felt like I was going to lose control of my knee. That has gone.
And this is her TMJ.
And I had a root canal done 30 years ago that was done by a dentist who really shouldn't have done it, caused a lot of injury. That's probably where the scar tissue developed. But anyway, so I went into Empower and I had my first shockwave treatment, which is it's an interesting feeling. It doesn't hurt. It's just a kind of a knocking on your skin. And immediately after the first treatment, my entire jaw felt like a wet sponge. I couldn't describe it any other way. Something was going on in my jaw. I could hear it crunching in my ear. I knew something was happening.
That we kind of explain on that, like the wet sponge versus a dry sponge. Okay, so We have a special offer for those that have joined us, and I think I'm seeing and hearing people are having a hard time logging in because I'm my phone is blowing up on text messages. So I don't know what's going on with that, but I have this recorded, so it's great. We can get it to those people. Uh, so the first step is if you're interested in learning more, I'm going to go through all these questions too here in a second, but we'll go through this first. But uh, we, do think how where you sit down and have a discovery visit where we can just talk a little bit more about what's going on with you and answer any of your questions that you may have so that you can kind of make a better decision. We always, if someone's coming in, we always want to do an evaluation before we do any kind of shockwave. Because again, there is an art of understanding kind of what's specifically going on with you because we do, change the protocol and like what how we use it based on kind of what's going on with you. Because I'll give you my example, 3 different knees that have come through here. And one we did who had like psoriatic arthritis and I mean horrible pain. And she's like, we did it on both of her knees. She's done her 6 treatments and she says she feels like she's 1,000% better. Now we're having to do therapy because her tissues were so like shortened because of the way she had to walk. That we're working on just trying to get all that function to improve as well. But her treatment was very different than someone else that came in that was wanting to avoid any kind of total knee replacements, but it ended up being more of like patellofemoral type stuff. So we've had to hit the shockwave in a different way for that client. We have another client that's having a lot of issues in the lateral part of her knee, where the outside, where they have more like scarring. You just can almost feel it. Like her tib fib that's just below her knee joint is where we're having more issues, and that's where we're going to be using it on her. So the evaluation definitely makes a difference with this. So you'll get $100 off your evaluation if you book this in the next 15 days. It doesn't have to be done in the next 15 days, just booked in the next 15 days. You'll also get a copy of my book if you already don't have it. That I wrote. And then if we decide that, yep, regenerative therapy is where you want to go, even if we say, no, we probably need to do a little bit more therapy, but first, and then eventually, yes, let's do regenerative therapy, the shockwave therapy, we'll give you $50 off that treatment as well. Either the individual treatment or the package that we have that goes with that. So that's kind of everything that goes on. There'll be an email that'll go out that'll explain a lot of this stuff, and we'll make sure that we follow up with you guys as well. But before I open it up for questions, I'm just going to kind of go through the questions because we got almost, oh my gosh, everyone had so many great questions. I think I answered a lot of it, but I'll just kind of go through them. One question was how to manage and eliminate pain without relying on meds. Can this work for muscle joint from immunotherapy along with osteoarthritis in the hands and legs? 100%. Like that's what I mean. It works with muscle pain. The joint pain is really where the bone pain is really where the focus shockwave comes in. That's the machine that we just recently bought. It's been a game changer on what we can do. And it basically takes that bone edema away like almost instantly. But we'll find it like with the person with the hand, she had all this swelling in her hands. And when we did the focus shockwave, it was gone in a treatment, like her swelling was gone in a treatment. So it's great. I have another person that developed chronic upper arm pain in both arms. No idea why. And she's wanting to know if we can help with some of those things that it's kind of hard to say without really doing an evaluation on something like that. But we have had people, like we had someone that had shoulder pain, definitely arthritic shoulder. We knew that it was, but we really tried to work on improving like her rib mobility so that her shoulder could sit in it back in a better position. So she'd have way less pain in the front of her shoulder because her shoulder was sitting so far forward. So we did a lot of that, which did help. But we went and did some focused shockwave treatment on her, and it was amazing. She's doing so well. Like her range improved, and we aren't even doing strengthening with her because every time we try to, it just kind of flare up. And I'm like, you just need to be functional. Like you want to just use it for everyday activities. Let's just do that. And she's doing great. Would like to know how Shockwave could help someone who's wheelchair bound. That's a hard question because I have no clue what's going on with that. I mean, it just depends on what's going on. So hard to answer that. So hopefully they're on. I know, again, we've had a lot of people that are trying to get on and haven't been able to get on for whatever reason, including my staff. How can Shockwave promote healing? So essentially, it's kind of like how I described. It's like you have that ankle sprain, you get all the healing that comes into that ankle to start having it heal. That happens in like a 72-hour process. Every time we do Shockwave, it's like bringing that healing component to that area, doing it again and again and again, which is why it can really speed up the healing. Can Shockwave help on bone knee pain? Yes. It on some of this stuff on the, if the knee is so far gone, that's where, it may not. But like I know we have someone that's interested in doing this, she's like in her 80s and doesn't want to have a total knee replacement. So I would definitely go this route first. Just because of the age, and you'll definitely get more function out of it. But if we can get people that have some beginning stages, it works really, really well. There's some biologics that are going to be coming, hopefully in the United States at some point. I don't know when, but at the conference we learned about them. They're in the UK and they're in Canada. They're just not in the United States yet. But when you use that with focused shockwave, they think that a lot of the joint replacements that we're having will go away. So there's some new things that are coming down the pipeline that are going to are really exciting. Um, how does the technology work? I think we went through some of those, talked a little bit about the science behind it. There's definitely a lot of more science with Shockwave than some of the other things that are out there. What's the cost? Is it covered by insurance? How effective is it for osteoarthritis in the hands? How does it compare to stem cell therapy? We get great results with the hands. I mean, great results. This unit is like the Shockwave is not covered by insurance. There are no codes. It's just too new that's out there. So insurance won't cover it. The cost of it, it really kind of depends. It's going to be easier for us to sit down, have a conversation. We have a encompassing everything because we want to decide whether we want to use all of it for you or we just only need to use focus. A lot of people will need everything, but like for instance, the hands, we only need to use focus. So the costing of those will vary depending on how like what we need to do and which shockwaves we need to use. Um, how can Shockwave help with my back pain, neck pain, and knees? It just depends on kind of what's going on, but like I think we've gone through a lot of this stuff. It just works really, really well. We had Wen that said, I've been told I have x-rays and I have very little cartilage left on my knee. Can Shockwave help with that? Um, yes. When you use the focus shockwave, it has a regenerative piece, like which means like they had we're at the conference, they looked at people like a person that had like an Achilles tendon that it was barely attached. And they did shockwave treatment and they followed this person over, I think, a 3-month period. And you could actually see the regeneration of that tissue, of that tendon get better and better and better and less like fatty tissue that was like in place of tissue that was damaged. It was quite amazing. So we can take the focus. The focus can go all the way through the knee, into the knee joint. So any parts of those areas that are damaged, you're going to feel it. And when we use the focus shockwave, it's like a deep ache. That's what, I mean, you just can feel it. When I used it on my SI joint, I was like, oh my God, I can feel it through the whole entire pelvis. It's really crazy. It's kind of a deep ache, but it works really well. A lot of, I think what happens with this, if it's not like changing the cartilage per se, I think it's more of like, it just reduces the bone edema. So you just feel better. Can Shockwave help heal the arthritis? The arthritis, so like as we get older, we tend to have just more arthritic changes overall. It doesn't mean that the arthritis that you have is actually causing you pain. But more than likely, if there is arthritis that's causing you pain, it just means that there's lack of blood supply in the bone, and we increase the blood supply, reduce the bone edema, and it feels better. And can Shockwave help with post-surgical shoulder pain? Yes. The crazy thing, we can use like, let's say someone does have a total knee replacement, we can use Shockwave with a total knee replacement and speed up that healing by like 40% because you can speed up all the tissues that have been damaged. You're going to start resolving a lot of that with a focus, with a radial shockwave, which is guarantee you, if you have a bad knee, you have some degenerative tissue around that. So we can get that tissue to start firing quicker and healing faster. And then we can get the actual, with the all the appliances from that total knee, you'll get the bonding of that to be much stronger and bonding much faster. So it works great with post surgery type stuff. Kind of depends on the surgery, but yes, it does really really well. Okay, so